Okay, the second contextual warning sign is noncompliance with treatment. So let's talk for a minute about noncompliance. I'm going to talk to you about noncompliance from a number of different perspectives, but would encourage you to document noncompliance. And if somebody is noncompliant with treatment, I'm going to talk to you about compliance protocol in terms of targeting noncompliance, but really address it in the clinical chart. So address it, recognize it, target it with the individual to try to improve compliance, and don't let it go on for too long. And I can't tell you how long that is. There's not really any evidence about how long I would let noncompliance go on. You really have to take it case by case. But what happens is at the bottom, so that if you let noncompliance go on too long, you facilitate hopelessness. So you actually facilitate one of the variables that elevates risk, because it's oftentimes in care, the way this really occurs is somebody partially participates in treatment. So if you came into our program and we're going to treat you for up to 12 sessions, we're going to give you a schedule from day one, and we're going to tell you that successful treatment means you'll be at every single session. And if you are not at every single session, you will be non-compliant with treatment, and treatment won't work. And then if you ask me, well, why do you think it won't work if I'm non-compliant? So if I did 8 of 12, why would it not work? And I would say it's really comparable to any time you take medicine, you have to take to the therapeutic dose or it doesn't work. You can't kind of do this treatment. You have to do all of it for it to be effective. That's what we know, is that if you'll participate in all of the treatment, it'll be effective for you. The probability is you'll get more out of it. And so help people understand that you can't kind of do treatment. Otherwise, what happens is they end up that treatment is hopeless and treatment doesn't work. And the number of people that we enlisted in this last trial that believed treatment would not work were people that never really participated in treatment, and that's what we talked to them about. That you've never really given treatment a shot. You've said you're going to do treatment, you come in, you do 2 sessions, you leave, you wait 2 months, come back in, do another session, you leave, you wait 3 months, come back in, do another couple of sessions. What I would encourage you is somewhere you have to draw a personal line about what noncompliance is acceptable to you as a clinician, and how much of the risk do you want to burden, how much of the risk burden do you want to carry. And again, it's an individual question, but I would not carry it indefinitely, and I would also recognize the longer I carry it, the worse the patient's going to do. And the evidence on that is pretty straightforward.